Very good evening. Assalamu alaikum wa rahmatullahi wa barakatuh. Greet you in the universal greeting of peace and love in Islam. To all our fellow viewers, please tell your friends and family Health Matters is focusing on Breast Cancer Month. Tell your relatives and all those close to you, they can Google itvnetworks.tv and live stream wherever they are in real time. We've also got our Facebook page up. You can catch any of our Health Matters show, important mental health and a varied array of Health Matters issues on the YouTube channel Health Matters ITV Networks. So we're down to quite a lengthy show, alhamdulillah, for the next hour. Stay with us. Informative as well. Health Matters is in season 8. Alhamdulillah, mashallah. We've got quite a bit of information out there on our YouTube channel. So do connect to that. We have done breast cancer before, but you know, times have changed, times are different. So we give you more update and informative information in today's show. We also chat to a breast cancer survivor. We speak to our specialist, some organizations working around that breast cancer awareness, as well as events happening. So stay tuned. You can connect with us via our WhatsApp line and also like our Facebook pages and our various other social pages. Do note we're having some exciting news lined up with a competition on our social pages, so please connect with our ITV Networks and Health Matters social pages, and you can see what we have up for grabs for this new lifestyle, healthy summer weather. And check out next week's show also. It's also got to do with summer. So breast cancer awareness, quite a serious topic, and we need to understand it and also be cognizant of how we can help those that have been affected by it, friends and family, as well as those that are directly been affected by breast cancer. Please note that we still are promoting the fact that social distance needs to happen. You need to sanitize wherever you are. Various aspects of the lockdown has been eased. We've seen level 2, level 1, but we've also need to understand there is going to be a possible second wave. So please be cognizant of that and protect yourself and others. So for now, we will be chatting to Zahra Kazi, and she's from Live to Give Foundation. We'll find out more about what they have up their sleeves, but more with Zahra Kazi. Assalamu alaikum to you, Zahra. Zahra, are you with us? Oh, there we go.
Yes.
How are you doing this evening? Shukran so much for your time. Zahra, you are practicing homeopath out in Rosebank, and you have a passion for holistic and natural medicine. Tell us quickly, how did you form Live to Give, and what was its main aim and mission?
Absolutely. So Live to Give was started as a bunch of friends who all ran together and decided that we should come together in the name of doing something good for others. One of our core principles, or the mission that we hoped, was to uplift girls specifically in terms of education. And so the project Sanitary Pads was born, which is aimed at providing girls in schools, specifically in El Dorado Park, with sanitary pads so that they're no longer missing school or missing out on valuable education and valuable time spent.
What are some of the core projects that you do focus on, and any ad hoc projects as well that are happening in between?
So we have Project Sanitary Pads, which is throughout the year we have a monthly drive, and girls get access to sanitary pads on a monthly basis. We are based at 3 schools, and we serve almost over 500 girls with sanitary pads. Our ad hoc projects, during COVID, we have a daily COVID feeding scheme. We also had a monthly feeding hampers that happened during lockdown, especially levels 5 and 4. We also had hygiene packs that were donated to girls and women that were the abuse of sexual assault. And sort of as things come along, we've added to it. The most recent being our cancer hampers that are go to recipients that are undergoing chemotherapy at Joburg and Baragwana.
Why was this started? And it's a sort of a reach out to those in the public sectors who often, not really recognize and maybe doesn't necessarily have the support. So what was the idea behind the cancer hampers? Who are the recipients? You've mentioned those at some of the hospitals, and when are they distributed?
So they're distributed on a monthly basis, usually at the end of the month. We distribute some 100 food hampers that include toiletries sponsored by AMCA, as well as Millie Meals sponsored by Meal SA at both Joburg and Barra. And we're hoping to be able to expand the project because every month we go and we see that there's a line of patients that still haven't received hampers. And so we're hoping that the fundraising takes off so that we can reach more patients.
What do the hampers consist of?
So a priority of the hampers was to have nutritious foods that were healing, and also things that were palatable for patients that are undergoing chemo. There's maize, like I mentioned, a lot of canned proteins like your tin sardines. There's your beans and tinned veggies, porridges, oats, milk substitutes, etc. So the focus was to provide something that was nutritious so that you aid the patient's healing as well as, providing them with basic foods, staples that they need.
So before we talk about, those that can get involved and how they can be part of, donating or just, as a volunteer, has COVID-19 impacted your organization in any way with those individuals that like to give assistance, and how can they help right now?
Absolutely. I think last year was a very successful year because we were able to go out and fundraise. And this year we've had quite a difference in terms of how we've been able to fundraise. Last year we did a 200-kilometer cycle and asked people to donate for every kilometer that was cycled throughout the day. This year we've sort of had to go online and turn our fundraising onto a digital platform. And so I think it's up on the screen now that we have our banking details, and we've turned to using social media and all the different networks to try and fundraise digitally instead.
Okay, so you've decided to have Eldorado Park as a beneficiary for the sanitary pads project. Why was that?
We often felt that Eldorado Park was a often overlooked community, and specifically the girls at Eldorado Park are from a colored demographic, and it's not often that organizations or aid goes out to these areas. In specific with Eldorado Park and the schools that we work with, we had people within the school. And so it was a very hands-on approach, knowing that we were making a difference and a tangible difference that we could see and get feedback on.
Okay, and firstly, lastly, Zahra, Live to Give Foundation, why are you specifically passionate about this project, and why did you get involved personally?
I think for me it's so easy in your everyday life to get caught up in your day-to-day routine and things that benefit you, and sometimes we forget to think about the people that exist outside of our bubble, outside of our network. So to me it was a way of reaching out, empowering girls and empowering communities so that they're able to grow. So that was, for me, it was about the empowering of communities and being able to make a change in people's lives.
So another organization that is making a difference is Benoni Ladies Forum, and Aisha Bibi Said is representing them today. Let's find out how they're involved with cancer patients. Assalamu alaikum to you, Aisha.
Aisha Bibi Said is representing
Aisha, are you with us? So Aisha Bibi said is a nurse from the Benoni Ladies Forum, and they stand together. She's also recently retired as Assistant Director of the Health for the Ukulele District and a member of the Benoni Forum for the past 13 years. They get together and they facilitate various projects and also cancer care hampers. If we can just get Aisha back online and find out what they do with regards to these hampers when it takes place, advise a nurse if she's still, practicing to get involved in this. She is in the nursing profession, has been since 1974, mashallah. Aisha Bibi said, are you with us?
Hello, yes.
Aisha?
Yes,
Okay, I can't
am.
unfortunately connect with Aisha at the moment, but from your side, Zahra, quickly Live to Give Foundation, are you concentrating specifically just on the Johannesburg area? Is that predominantly where you guys focus on? Zahra, are you still with us? Okay, it seems like we've lost Zahra as well, but Aisha Bibi said, are you with us? I cannot hear Aisha at the moment. Let's just take a short break. When we come back, we'll connect with Aisha Bibi Sayed, a nurse from the Benoni Ladies Forum, and find out how they get involved with the cancer patients. Back in a moment. Stay with us. Don't go anywhere. Assalamu alaikum and welcome back. Hopefully the technical gremlins have all been sorted out. Thank you so much for staying with us and being patient as we now interview Aisha Bibi Sayed, a nurse from the Benoni Ladies Forum, and find out what this organization is doing for cancer patients. This evening we focus once again on Breast Cancer Month. Assalamu alaikum to you, Aisha.
Wa alaikum salam.
How are you doing?
Alhamdulillah, and yourself?
Good, alhamdulillah. Shukran so much for joining us. We finally connect. Aisha, tell us a bit about the Benoni Ladies Forum.
Okay, the Benoni Ladies Forum started 13 years ago. Initially, we were running the family, the project with the Benoni Muslim school, and from there we branched off, forming a ladies group. And ever since we've been with 13 ladies, and we've been running projects every year. Different types of projects where we have fun days and raising funds, where we have days where we take the orphans out on a picnic yearly, where we especially with the grannies, we have a granny picnic day once a year for them, where we give them gifts and just take them out on the bus ride for a picnic. And we have weekly feeding schemes in the hospital and at the clinic in Ettenville, with a sandwich group that they do on a monthly basis to various schools. And now with the COVID, we've been very busy with the COVID, making packs and distributing to all positive patients, which was done very well with all the donations we had. There's lots of projects that we actually busy with.
So this is the reason why we're in contact with you today, specifically is about the cancer care
I can't hear you. You're very soft.
Okay, let's try that again. Tell us about the focus on your cancer care hamper, Aisha.
Yes.
Tell us about that. Why did you guys initiate it and what does that involve?
Like I said, it's a lot of projects that we are busy with. So we call it Cancer Month now. And Zahra actually initiated this project, and she wanted us to be part of the program. So we just contributed some part of the inside of the package. So this is how we became involved with her.
Okay, so let's look at the focus on you specifically as a nurse. Tell us a bit about your involvement in cancer patients.
Okay, my involvement with cancer is I'm actually a nurse and very involved in community health aspects. Yeah, it's being Breast Cancer Month now. Mm-hmm. We tend to forget that this is not just about the cancer. It's about a person that needs to be, that needs holistic help. So it's actually a team. We must remember that it's a team effort. The approach for us in order to handle or to deal, to help a cancer patient needs to be holistic. And by holistic, it's meaning you're taking into consideration the person's mental, physical, and emotional factors into account, and not only the symptoms. What they actually need is one to listen to them. And when I say listen, I mean you listen with your heart and not your ears. And you don't show any denial. You yourself as a family, you need to accept. Sometimes you're also in denial, but your feelings you should not show to the person. And we always like to say, it's going to be all right. Don't worry, things will get better. We should limit on how often we say that. Rather say, we'll get through this together. You're not alone. Try to be normal, as difficult as it is. Try to be normal when you're dealing with a patient that just heard that now I'm positive. I've been diagnosed with cancer.
Yeah.
And our communities, we focus a lot on HIV and all other things, and we're forgetting about, the cancer, the various types of cancer. This is why in the health calendar we have now, like the breast cancer month, where we put a lot of emphasis on this. And during this time, it's to make people aware of the breast cancer. Maybe just wear a pink ribbon, and people can ask you, why are you wearing this ribbon? And then you can explain to them and also educate them to be more aware of what what breast cancer is all about. Sometimes we're having awareness campaigns. We have high teas and dinners and things like that where you raise funds, and this money can go to hospice or to the NGOs or wherever people are busy with, with care packages and things like that for these people. It's not everybody that can afford these care packs. So we sometimes tell them, you need to have nutritious food, you need to do this, you need to eat this, you need to take care of yourself, but we don't give them the help. It's not everybody that can get the help. It's not everybody that can afford to buy this nutritious food that we save them. So the donations can also help them and these care packs, I think we should also not restrict them to the month of February or, to the month of where it's a breast cancer month.
Yes.
I think we should try and do this on a monthly basis to make sure that we can sustain these things.
Sure.
So if we give awareness to the community, I'm sure the donations will come. We can sustain some donations,
Absolutely.
for us to continue with these care packs and things like
Aisha
that.
Bibi said from a nurse at and also belongs to the Benoni Ladies Forum, teamed up with Zahra Kazi from Live to Give Foundation and their cancer care hampers, and having professionals behind the scene as well to assist and talk to the breast cancer survivors and patients. A big shukran to them. So please donate generously to these organizations. Jazakallah to you, Aisha Bibi said, and Zahra Kazi from Live to Give Foundation and the Benoni's Ladies Forum. Please do connect with them. For now, let's look at some of the signs and symptoms of breast cancer.
There are several signs and symptoms of breast cancer, and one of the ones that folks know the most about, of course, is the lump, but there are others, like any unusual rash on your breast that may be dimply. It could be flaky, the skin could be flaky. Any discharge in the breast, blood or fluid other than breast milk. The inversion of nipples, any unusual swelling in any area of the breast. So I really want to encourage young women to know what your breasts normally look and feel like, so that when there is a change that's unusual, you can follow up with your doctor as soon as possible.
So I'm now very pleased to announce that we now will chat to a breast cancer survivor. Anthea Lynn Lewis is brave enough to tell us about her journey. A very good evening to you, Anthea Lynn. Thank you so much for your time.
Good evening, Aisha, and good evening to the viewers and listeners.
So Anthea, tell us a bit about yourself. You are a breast cancer survivor, but you also work within the Western Cape Cancer Association, caring for 237 children and teenagers that has childhood cancer. Tell us the role you play with currently and a bit about yourself as well.
Okay, so I work with children, and my youngest is a baby of 3 months, and my eldest is 18. So I work from start of diagnosis right throughout treatment, whether the child goes into remission, whether the child's cancer is cured, or whether the child becomes palliative. So from start of diagnosis right until the end, where we offer support, we do the palliative support and also the food parcel support.
Okay. So as a breast cancer survivor, this must have been, and I know you think of it as probably a lifetime ago, but it has happened to you. What were the emotions and the feelings like when you heard the word that you've been diagnosed with cancer?
Life-changing and life-altering. I was 38 at the time of my diagnosis. So for me, I was still young. I was more concerned about how I was going to look, about the people in my life. So initially, it was more about the people in my life. And when my cancer came back the second time, it was all about me. It was about putting me first and actually taking on this cancer journey. It took me through some rough patches. Yeah, so it was about me. It taught me about being there for myself.
Yeah. What would you then advise, besides that message of, focusing on yourself and being there for yourself, to other women that are actually going through this journey of as a breast cancer patient?
I think normally when we hear the words "you have cancer," people it's almost like you go and sit in the corner and you wait for death. I want to encourage people that if cancer is detected early and your treatment starts early, then your chances of survival increases dramatically. And we can be 5 women with breast cancer, but each one's journey will be different. Each one's diagnosis different. Each one's treatment is different, as well as each one's support system will be different.
What has cancer taught you today? And waking up in the morning and looking at yourself as a cancer survivor, what was the biggest message that that stands out for you and that you take with you through every day of your life?
The fact that I've not been only given a second chance, but a third chance in life. So I am all about embracing life. I'm all about living each day to its fullest, and I leave room for no regrets. So cancer has taught me that that I can love myself and that I need to be there for myself. It has also taught me resilience, and through my cancer journey, the calling of working with cancer patients has been placed on my life.
What other advice would you then give to family, friends, community members that are in contact with cancer patients, breast cancer patients? What do they need to be cognizant of when they are talking to cancer patients or breast cancer patients, and how they are handling them, or even just mentioning what they should, should you be aware of what you're saying to them?
Most definitely, and a lot of the times when people start talking with you, once they've heard that you've got cancer, the immediate reaction is "hi, shame," and I always battle with this. Why are you saying shame? Because it's not you that's given the person the cancer. So for me, it's just about being there. Sometimes you can support in silence, sometimes just being there, sometimes just offering a hug. We find many times that when people is diagnosed with cancer, it's not really the immediate family that's always there, but they draw support from neighbors coming around with a plate of food, neighbors coming just to check in, and we never will. When someone is diagnosed with cancer and you immediately, as a husband or as a wife, fall into that role of caregiver, there's no manual that can prepare you. There's no A to E to tell you this is what's going to happen next and this is what you are going to do, because, like I said, each one's cancer journey is unique, and people that has gone through cancer, they speak the same language because they know what it's like to go for that operation. They know what it's like to go for chemo. They know how radiation makes them feel. So basically the family and friends are standing on the outside looking in, and the best way to support is just to be there.
Anthea Lynn Lewis, breast cancer survivor, as well as cancer, CANSATLC coordinator for the Western Cape. Please do connect with cancer.org and there are various links on childhood cancer, breast cancer, and information that you need to know. Big thank you to Anthea Lynn. Have a good evening and goodbye for now. We do connect with another cancer survivor after our short break, and also representing a cancer organization and our specialist just after this, where you can ask your questions.
So there are a few things that we can do to reduce our risk for getting early breast cancer. And some of those are things that can be done that usually reduce the risk for other kinds of diseases later, like, maintaining a healthy diet, maintaining a healthy weight, reducing your alcohol consumption, getting enough sleep at night. Then there's some other things like breastfeeding our babies when we have an opportunity to do that. We know that, women who breastfeed their babies are less likely to be diagnosed with early breast cancer.
Thank you to the Centers of Disease Control and Prevention, CDC, and that information on how to reduce your risk of breast cancer. Let us heed to that and definitely bring down the numbers. I'm Hawa Solomon. Welcome back to Health Matters. We now chat to a support group, ICAN Cancer Support Director, Ronnie. Very good evening to you, Ronnie. Thank you so much for your time.
Good evening, and good evening to all the viewers.
So quickly tell us, who is Can Survive Cancer Support? You are the director of this organization. What is it that you guys do, and when were you established?
Can Survive is a cancer support group for cancer patients. Mm-hmm. We help cancer patients throughout their cancer journey, from the time they're diagnosed right up to the time they either finish treatment or they retire and become old and stuff like that. Because some of these patients take treatment throughout their lives. So at the support groups, we tell the patients we give the patients all the information that they are not given by the doctor or by the hospital. They also meet up with people who suffer from the same cancers. And our support groups comprise of people from various walks of life with different kinds of cancers. But the most interesting group are the breast cancer ladies. They are the most vocal, they are open-minded, they are opinionated, they are amazing overall. And they like to play around with their prostate, boobs.
Yeah.
They are the people who are actually the live wire of our support groups, because they are the ones who give talks when we have awareness events, and they also are the people who are always at the forefront of things. They also attend all the events that are organized by the Breast Health Foundation and other cancer organizations that deal with breast cancer. As members of Cancer Alliance comprises of all the organizations that are registered as cancer organizations. And now we do collaborations, and each and every organization has a different way of functioning. Most of the organizations do awareness events. Can Survive does the support part of cancer. So we bring together people with the same or different cancers. We bring them together. We hold meetings. At these meetings, they get to discuss with people who underwent the same experiences, and also they receive advice from various people, experts that we call in at the meetings. Normally, each and every meeting has a different kind of speaker. Some of the things that we do at the meetings, we discuss diet, we discuss occupational therapy, we discuss depression and stress management. By the way, we have the services of a psychologist
Okay,
and a registered mental health therapist.
great.
Members of Can Survive receive free service from those two specialists.
Brilliant.
And also, our support groups participate in various therapies like laughter therapy, which is part of healing, and also music. We play music at the support group meeting so that people can be able to learn how to relax.
So Ronnie,
We teach them a lot of things.
yeah, Ronnie,
And as far as the families
Yeah.
and the spouses and caregivers are concerned, we welcome them so that they can be able to know how to live with a person who's got cancer.
brilliant. Good
You know, in
connection
various
to latch on to
families, you
those
find
that are
the-
around them as
The
well.
person who's got cancer is ostracized
Yeah,
and neglected by the family. I come across such cases quite a lot because I go to various areas
Yeah.
where people have cancer and try and see if at all we can establish a support group or not. And I've also discovered that people tend to lack information about cancer.
yeah,
Another
unfortunately.
problem is men who've got breast cancer
Yes,
are very reserved and they don't want to talk about it.
yes.
At the support group meetings, you know, they only open up to me that, no, listen,
Sure.
I've got breast cancer. I mean, it's not a shame to be a man and have breast cancer.
Absolutely.
I don't see what is wrong in telling people what kind of cancer you've got.
So-
because,
so
all the
Ronnie,
people
Ronnie,
that
can you
are
hear
at the
me?
support groups all have cancer.
Ronnie, can you hear me? Ronnie, we have to wrap up, but I just want to check with you as a cancer survivor. Why do you think, you know, and you've mentioned now men with breast cancer, why do you think it's, besides the men with breast cancer, why is it still a taboo? Or have you found that people, you know, there are some people that do not want to talk about their status of cancer or even breast cancer? And why is that? Oh, it seems, Ronnie? Okay, it seems like we're having a bit of a bad connection with
Chemo or
Okay, Ronnie.
radiation or hormonal treatment for
Yes. Okay, I'd say unfortunately we're having a bit of a bad connection with Ronnie. It's just so disappointing because we've just been tackling such pertinent information. But thank you so much, Ronnie, for your time. Please do connect with Can Survive Cancer with the director, Ronnie. Pertinent information and a great support group to latch onto for the family, friends, and those cancer patients. We'll talk more with our specialist just after this. Do stay with us in Breast Cancer Awareness Month.
I think the best thing to do when you start thinking about whether or not you're at high risk is start talking to your family. Have we had any male breast cancer in the family? Have any women been diagnosed with breast cancer before the age of 45? How many? Those kinds of things young women need to be aware of because they do increase her risk for getting early breast cancer. That part can be challenging because there's some families that don't talk about sickness. They certainly don't talk about cancer or, you know, like my family, it's not a conversation that we generally like to have. The first step that I would suggest is, you know, finding that family member. There's always one who's the one with information, the one who kind of likes to talk and kind of start there.
Welcome back. This is Health Matters. We're touching on Breast Cancer Awareness Month, not just the topic at hand. How do you get it? What happened? What are the signs and symptoms? Some great information from the CDC videos, which you can find online as well. But now we speak to the specialist, urologist, Dr. Gulzar Malik. Appreciate his time and expertise on this matter. Assalamu alaikum to you, Dr. Malik.
Walaikum assalam, viewers. Jazakallah ITV. Thanks for the invitation. It's nice to be here.
So, Dr. Malik, we understand the word cancer, and the word springs around. We're aware of it, that it's within our body. But the scary part is when that cells are activated, we realize that, oh my goodness, we want to find more and more about cancer. What do we need to know in today's age, today's time, about cancer and how it's evolving?
Yeah, the cancer, it is very common problem. If you see 1 in 4 people will get cancer. I'm not talking about breast cancer as such. So cancer as a whole. So it is quite common problem now. So main thing is that what we have to do is that about the cancer. Cancer is basically it's excessive abnormal growth of any part of the body. Like, that the unit of the building is called brick. The unit of body is called cell. So it is uncontrolled, that growth of the part of the antibody. And today what we are discussing is the breast cancer. It is breast, basically breast.
Yeah.
So we have to, if we don't treat it, it will continue to grow.
So some of the stats, South African stats, says that breast cancer is the most common type of cancer among South African women, and 1 in every 31 women are diagnosed in her lifetime. Why is breast cancer such a common type of cancer in South Africa? And let's talk about some of the stats as well.
Yeah, it's not only in South Africa, all over the world that breast cancer is very common. Well, it's female cancer. It is basically, there are a lot of risk factors. Number one is family history. That's important. Family history, it runs in the family. So that's one thing. Number 2, our lifestyle is important, So the lifestyle, alcohol, although in, that in Muslim communities, alcohol is not the major problem. Then obesity is the other risk factor. So lifestyle, then a little bit high blood pressure and sugar and all these things. And being female, that is the most common risk factor, because the female, being female, there is hormone estrogen, which is released by the ovaries, that can stimulate the breast and which can cause breast cancer. Then it is basically hormone replacement therapy. It can cause, even contraceptives also can cause breast cancer as well. So there are a lot of smoking is another thing, other risk factors. So our lifestyle is there. There are a lot of factors where breast cancer is very, very common. That these are the reasons.
Okay, so it is said that the mammogram can save your life. Why is that?
Yeah, the main thing among cancer, it should be picked up very early. So mammogram, it picks up cancer before a patient herself or doctor diagnose the cancer. It palpates the breast. So it is diagnosed in very early stage when tumor is maybe in few millimeter. When there's few millimeter, then it is easy to basically treat it. The cure rate comes to up to 95 and up to 100% if it is diagnosed early. So that's why mammogram, it is important and it can save lives.
Okay,
that's true.
Let's talk about the mammogram and the age women should actually go for this test, and then specifically for women that have it in their family already. Is there a difference in ages to go for that first mammogram exam?
Yeah, no, it is the mammogram is important, but before that there is some self breast examination that's important, and clinical breast examination by the doctor is also important once in a year. But self-breast examination is also important from the age of 20. But mammogram, it is important, there are different recommendations, but usually we say from the age of 40, every year, from the age of 55, if there is family history, then continue every year, otherwise every 2 years. So there are different recommendations. So, and especially if there is a family history, then it is important to have mammogram at early stage, even sometimes from the age of 35. And nowadays, even the breast cancer are being diagnosed very early stage as well,
Okay.
even in their 20s.
So the tests and the various different stages of breast cancer, do you get, what is that involved, and do you get different types of breast cancer?
Yeah, there are different types of breast cancer. Usually, when breast cancer, we take basically ductal carcinoma, which is the main one, and then we also have lobular carcinoma. But then there are other cancers like thyroid tumor, which is sarcoma, and other uncommon as well. But these are the two main common ones. And then these two, lobular and ductal carcinoma, then there are different subtypes as well.
Let's talk about treatment and the way forward. What does that involve? Because there's radiotherapy, chemotherapy, hormone therapy. Let's talk about that and what that does involve.
Yeah, there are four types of treatment. Well, number one is surgery. Surgery is important, and surgery should not be mutilating. So if cancer is diagnosed at early stage when tumor is small, so even the lump can be taken out, and with lymph nodes, sometimes even we don't need to take lymph nodes out as well. We do need a sentinel lymph node biopsy. So after that, if it is negative, then only lump can be taken, and the patient can have after that surgery with systemic treatment, which means chemotherapy and radiotherapy. So in that way, because removing whole breast, it is not necessary in early breast cancer. So that surgery is the one. Sometimes if cancer is advanced, then surgery, whole breast can be removed with the lymph nodes as well. Then comes to chemotherapy. Chemotherapy, it is the use of medication, cytotoxic drugs, anti-cancer drugs. So usually in the form of IV, intravenous, or sometimes the oral as well. So these are oral drugs as well. So these are drugs. So all the drugs, sometimes the patient come to us, they are very concerned that, oh, doctor, chemotherapy or radiotherapy, cancer treatment is not the same as 30, 40 years back. And all these chemo drugs have been tested in clinical trials. And side effect, most of the patients, they tolerate well. There's no problem with that. Although there are some side effects like nausea, vomiting, but we got very good medication for nausea and vomiting nowadays, and also loss of hair. These are not really, but it is temporary thing. Then, the blood count goes down, but we got a lot of support. So 95%, there's no problem. There's not really much problem.
Okay. Dr. Malik, we have to wrap up. Unfortunately, our time is up. Just quickly on family support and the necessary support systems that we have to have around us. What is the best way to manage that with the community at large and individuals in your home?
Family involvement is very important. That's called complementary treatment. And when patient has this breast cancer or any type of the cancer, it is important to have family support. Family must be involved. They must know what is happening. They must know what are the side effects so they can go better. And it's important, emotional side as well. Okay. So even especially if it is spouse, the husband must be very supportive as well, because it's a little bit difficult time. Although at the moment cancer is curable, and most of the women, especially in early cancer, they will be cured, and life will be normal. It's not the end of life. So family support is very, very important.
Absolutely. Dr. Malik, a urologist and specialist, we do have quite a few questions. Inshallah, we'll post them through to you and thank you for your time. Unfortunately, that is all we have time for. It's a pleasure chatting to you.
Sorry, the oncologist.
Oncologist, maaf. Oncologist, shukran for your time. We appreciate it. We will be sending through some questions that just came through from our viewers, if you don't mind. But we appreciate all the best. Assalamu alaikum.
No problem.
All right, so
Thank
that
you
was
very much.
Dr. Malik, and our various support systems that we've mentioned throughout the show. Please do connect with Health Matters Facebook page and ITV, like it. And remember, we have a competition that we're very excited to introduce to you. Next week, stay hydrated. This hot weather, how are you doing through it? But we'll tell you more about it next week. Stay tuned to ITV every Tuesday with repeats Wednesdays and Sundays. Assalamu alaikum and goodbye for now.